Oh, okay. Thank you, Mandy.
Okay, hi. Can everyone hear me?
Yep.
Cool. Okay, so my name is Bianca Armenta. I have been the summer intern here. Um, and this is actually my last week in office. My last day is Friday. I can't even think about it. I've loved my experience here. So that said, this is my presentation on hepatitis C and its effects on the brain. Um, let's get started. So, shoot. Also, disclaimer, there will be typos. Forget it. Let's just move on. Okay, so the reason why I wanted to do this presentation is because in all of our trainings, in all of our discussions, there's kind of like a general idea that hepatitis is more of like an asymptomatic disease, um, and that it mainly affects the liver. And some of the symptoms include like fatigue and like brain fog. Um, and I would say that that could be harmful because, in my experience as a person that was born with hepatitis C, there are so many other symptoms that can impact your life. And so just to kind of minimize that, I think it could be potentially harmful. Um, and so the following slides, they are just intended to explore possible cognitive symptomology of hepatitis C. So just to give you an idea. Okay, so let's talk about the brain really quickly. As we I believe should know, the HCV virus can actually cross the blood-brain barrier, which means that everything that goes on inside our brain is impacted by this virus. So it is causing potentially damage to the liver, but it's also influencing the functionality of our brains. So I want to come back to what is brain fog. So I kind of want to take a moment here on this pretty slide. This one's my favorite, and open it up to everyone, because I feel like in my 28 years of having had hepatitis, the one thing I heard is like brain fog. You have brain fog. When you're done with treatment, you won't have brain fog anymore. So I kind of want to open it up to everyone and just ask, like, what do you think this is? What do you think brain fog is? Any ideas?
Hey, this is Kevin. I can take a quick stab at that. Brain fog is just kind of like the way I've kind of had it described to me is like feeling kind of slowed down, struggling with like remembering words, feeling like their thinking processes are just like moving much more slowly. Um, Kind of just like feeling of detachment a little bit, kind of those sort of things.
Yeah. Uh, anyone else have any ideas or thoughts?
Hard to
I can share
focus.
my experience.
Yeah.
I lived with Hep C for at least 30 some years. I started before I had been diagnosed. I actually went to a doctor. Well, I went to several doctors saying, what is wrong with me? But one thing in particular, I remember I started having kind of almost not quite aphasia, but trouble with words, trouble identifying words, like that thing you pull through your hair. I couldn't find brush. But it was more than that. It was also that feeling sometimes of really having to struggle through my thoughts, like sorting things out. It's very difficult to explain brain fog that hadn't experienced this particular type of brain fog. And it did get better some years after I was cured. Unfortunately, I did not do the newer treatments. I did the older treatments, and it took me a long time to recover from that, which also impacted my brain, I believe. But overall, after all these years of being cured, I did not experience, and have not continued to experience that. I almost want to say sensation. Also something that, if we're talking about the brain, sorry if I'm jumping ahead, but, we do know anxiety and depression is more prevalent in people with Hep C. And those are certainly things that I experienced over the years for different reasons. But I think the Hep C was related because my level of anxiety has never been as high again as it was before the years when I was cured. I hope that helps some. It's difficult to explain. It really is.
Yeah. Well, thank you for sharing all that. Yeah. This was just to get everyone kind of thinking, like from a patient's perspective, when you're told, you have this thing, but what does it mean? So thank you for sharing. Anyone else want to throw in any ideas or? Okay, I'm going to move on. So we're going to get into quickly just like an overview of like how the brain works and all of the things it controls. Because essentially like the functions of the brain make us who we are. I mean, it's controlling our personalities, our judgment making, our emotions, our memories, our focus and attention. Let's see. Our ability to learn. It also regulates our sleep patterns and how we process internal and external sensory. So I didn't get your name. The person who just shared their experience with hepatitis. What was your name?
It was Robin. It was me. It was Robin.
Robin. Okay, thanks, Robin. So like Robin was explaining, like this struggling to remember things, this feeling of being like bogged down, it all comes from the brain. And that is all due to the virus actually penetrating that blood-brain barrier. So I have also some psychosocial symptoms. Now, when you think about this, I know the primary psychosocial symptom would be something like stigma, feeling stigmatized. But there's also other things to consider as well. If you're not feeling well, if your digestion is impacted by this disease, you're probably not going to want to go out and see friends. If you're having depression or anxiety, probably not going to want to be social. Also, if you are in a community, you have community with other people that have been through treatment. I know that the previous hepatitis treatments were horrible. I mean, just a personal story. My mom went through a couple of rounds of that, and I saw her go through that, thinking in my mind, oh my gosh, I'm going to have to endure that too. And it didn't even work for her. So there is that, I would say, previous trauma experience of of hearing or seeing other people or yourself go through these harder treatment regimens. And yeah, I think that can pose a barrier as well to a lot of social interactions. So now we get into quality of life. So any impairments of like our executive function, our emotion regulation, our decision making, it can be expressed in a multitude of ways. So like antisocial or inappropriate social behaviors, impulsivity, engaging in like very risky behaviors, with like not a lot of thought given to the future or consequences. Also, like fluctuations of mood just in general. There is a much higher rate of depression and anxiety and anger in people that have hepatitis. Also, like learning disabilities or struggling to recall memories, as well as increased fatigue and like needing to sleep more, needing to sleep longer. That's, I believe, one of the highest reported symptoms of hepatitis C. I know in my experience, towards the end especially, it felt like I was always never fully awake. And it was like I could never sleep long enough or deep enough. I was just always so exhausted. And also that just leads to like an inability to make sense of the world, the environment that you're in. I mean, if your basic like brain functions are being impaired, it's going to be so much harder to really be in the world and be in your environment and make sense of it as well. So some of the knowledge gaps. I will say, after talking about all of the symptomology, each person is a unique individual, and the virus is known to present itself differently. So we can have people that have a lot of symptoms, very severe symptoms, and then we can have other people that experience little to no symptoms at all. Also, the symptoms that can be expressed are going to be heavily influenced by things like drug use, their external, environmental, and social factors, mental illness, their trauma history, as well as other illnesses. So thinking in terms of the people we serve here at HEP, many of them have a lot of these other external factors as well, which means that any symptoms they have from hepatitis could be like further exacerbated. So getting into creating an ideal treatment environment, I would say the one thing that I wish going through treatment myself was that my doctor, who is wonderful, Dr. John Scott, could have prepared me better. He's never been through it himself, and so he had to give me like secondhand information, and it was just kind of like, oh, you'll be fine. It's not a big deal. But after having lived 28 years with this disease that was constantly every day influencing who I was and how I acted and how I thought, Going through treatment and being cured, that change didn't stop then. Like even to this day, I'm still like improving. I'm gaining my memory back and language, and my personality has changed so much. And so for those of you that don't have experience with hepatitis C, I would just advise that you honor and recognize everyone's different experiences. Cultivate open communication and active listening. And if we have clients come in that are experiencing symptoms, just listen and don't minimize it. And for whatever changes or improvements they see happening in their lives, definitely celebrate that with them. Because essentially this could be a huge, a monumental change in their life. And so definitely taking the time to honor that, I think, is very important. And that is my presentation. Does anyone have any questions or thoughts?
Hey, Bianca, Michael here. I just wanted to thank you for that great overview and sharing your personal story. I think one of the issues around symptoms, and a lot of people think there aren't any symptoms, but when they do exist, things like brain fog or myalgias, aches and pains, they mimic symptoms of aging as well. And so if you're getting older, you're in your 40s, 50s, and you're, to Robin's point, it's hard to kind of explain what brain fog feels like sometimes. But a lot of people, especially those who are undiagnosed, who have symptoms, often don't think anything of it because they think this is just me getting older. And I do think that's one of the confounding factors around folks who are symptomatic and not getting tested and diagnosed. And it's amazing once people do get treated and cured, and as soon as people become aviremic on treatment, we hear over and over. Now, with interferon-based treatment, it was different because people were being bombarded with this, highly toxic drug interferon, and that stayed in the body for, months. But on these new all-oral regimens, we hear time and time again, people test negative at, whatever it is, 4 weeks, 8 weeks, and then a lot of people talk about having this kind of cloud lifted, and they feel better mentally, they feel better physically, and people talk about that before their negative test results even come back. And so there is a lot in the literature around patient-reported outcomes of just this kind of new vitality as soon as folks get get virus free. And I don't know if that was the case with you, Bianca, but it is something that is not uncommon.
Yeah, and also your perspective is really interesting too, because as a young person that had it growing up, it instead of chalking it up to like age, it was like chalking it up to learning disabilities or ADHD, behavioral issues. And the incredible thing is the brain does not stop developing until your mid-20s. So if you're a young person that acquires this disease and you have this virus that's constantly attacking your brain, as it's developing, that could potentially have different impacts and implications for people's lives. And also, yeah, going through treatment, I actually have a really beautiful story. It was sometime in the middle of my treatment, that feeling that I had almost my whole life of never quite being fully awake. One morning I woke up and I was awake. Like I was the most awake I'd ever been in my whole life. And I just remember laying in bed and like watching the sunrise over the trees and just crying because I'd never seen a sunrise before. And I was just so awake and alive. So yeah,
Wow.
I don't know, Robin, can you add anything on that too as well, your experience? If you want to.
Related directly what you're saying, no, because it was interferon and ribavirin, and it took me a few years really for my brain and my body to recover from that. So, but I get a sense of what you're saying, and I didn't have any profound experience like that. It was a gradual thing. I think I would, but it would be like I'd have moments of realization, you know. I was like, oh, this is different, which was pretty fabulous. And I just love that you shared that. That's pretty amazing that it happened for you like that. There are two, we're one of the other things I wanted to reflect on. One was, you know, one of the things when I do talk to people who are newly diagnosed or who've been diagnosed for a while, about symptomology is a lot of people with Hep C assume the symptoms they have are because of the Hep C. And I try to remind people to, if they have new symptoms or something's been going on, to talk to their doctor and be sure and get a diagnostic workup, and don't assume these things because they're on a list of symptoms or Hep C. So they don't automatically assume they are. I can't tell you the number of people that have had different things going on and they're like, oh, it's probably my Hep C, and don't pursue it. And it's really important that we remind people, no, you need to get an evaluation if you're having something that's impacting you, because it may not be the Hep C. You may miss something really important. Another one little point that I wanted to jump back to was the stigma. And really understanding and honoring the fact that a lot of folks, when they're diagnosed, that stigma is internalized and kind of manifests itself internally as shame. You know, the stigma is really, the external stigma creates that shame a lot. And, you know, there's, again, I've been talking to people with Hep C for a long, long time, and so many people say, well, you know, I did this to myself. I deserve this. I did bad things. I actually had a doctor once ask me if I did bad things in the 60s. I mean, it's so pervasive and it's so internalized, I think, a lot more than we realize. And don't have any great solutions other than, you know, being loving and accepting and talking to people and reminding them they didn't ask for this. But it's a pretty powerful thing and important to be aware of.
Yeah. Well, I'm sorry that happened to you. That's horrible. Yeah, I definitely understand where you're coming from. I got it from my mom, and I was raised like my whole life to like never talk about it and don't tell anyone. And I had a lot of fear of like anyone ever finding out. And then just recently I realized that my mom, like her and I have had two totally different experiences because I was born with it and she acquired it. And so she carries like guilt and shame and fear. Well, she's cured now, but These were all emotions that she felt, and I never even realized that she felt very isolated in that.
I just wanted to hop on real quick and thank Bianca. This is her last staff meeting with us, and it's been a pleasure to have you as an intern. And I think this presentation and listening to you and Robin talk about your experiences just really highlights how unfortunate it has been, like during the pandemic, that we've really had to reduce the number of clients we have in the office, and the opportunity for folks to be together in community and share their joint experiences and their different experiences. That any plans we had for cabs and peer work really got put on hold, and just how important people's lived experiences and for patients to be able to share their stories with each other is so meaningful for educating each other, educating themselves, and then also educating us, their providers. And we've really missed out on so many opportunities. So Bianca, thank you so much for, being willing to share your story, for wanting to come and, spend your summer with us. And I look forward to continuing to work with you on the few things we're going to work on. But I think this presentation was your idea, and I just want to thank you so much.
Yeah. Well, thank you all. You've taught me, I've learned so much, and you've been so patient, and I appreciate you all.
This is Adrienne. I echo all that Amber said, and thank you, Bianca, to you as well as to Robin for allowing us to hear and learn from your experience. If you're interested in advocacy, please let Robin or myself know. We have a fierce patient advocate named Rick, who was also born with hepatitis C and just graduated from his NPH program, that I think would be a great person to connect you with at some point. So let us know if you're interested in that. But I did have a question, just reflecting on, from a pharmacist perspective, a lot of our role is to educate people on things like side effects. And one of the things that you mentioned was being better prepared about what to expect. And it made me think about some of the education that I've had to do during COVID around the COVID vaccine. And there was a lot of discussion around how much information do we give people, right? Do you tell them all the possible side effects that they could expect? Or do you try to, be more optimistic and say you'll probably be fine? And what I found that it was more helpful to strike a balance between the two, to be honest about what the side effects were, while also trying to instill some hope and that, like, you'll get through this. So I just wanted to know if you had any thoughts around kind of the best way to present that information. And I recognize that probably different people have various thoughts on how they'd like to receive it. So just from a general provider education standpoint, I think this is really helpful for our two student pharmacists who are on the call to hear as well. Any thoughts that you have around that would be greatly appreciated.
Yeah, thank you for that, Adrienne. So, and this is just opinion here, but everyone is different. I feel like, there are so many different people. Some are going to want every last detail, and some aren't. Some are going to be the opposite, and then everyone in between. So I think it really comes down to knowing who you're talking to, who you're working with, and just acknowledging your own lack of lived experience, and acknowledging that there are so many potential outcomes, symptoms, and not minimizing any concerns or fears, or experiences that they have. I don't know if that kind of gets at what you're saying.
Yeah, it does. Thanks for that.
Anyone else?
Sorry, I was on mute. I just want to say thank you for everything that you've brought to have, Bianca. Just your enthusiasm and inquisitiveness and the lived experience, which or for which there's really no substitute. And thank you for sharing that in a variety of venues. And also thank you for bringing your mom up. It was lovely to meet her.
Yeah, thank you for having me, and my mom.
Bianca, this is Daniel. I just want to echo what Michael said, but also build on your response to Adrian's question. From an educational point of view, whether it's about the experience of brain fog or the choice to do hepatitis C treatment, is there anything that you wish that you'd known or you'd heard earlier than you did?
In my experience, for me, the like lifting of the brain fog was very significant. I mean, I didn't feel prepared to essentially have every aspect of my life change. And so, how do you prepare someone for that? I don't know. I don't have the answer. But I think just having these discussions with people that have lived experience that can report back to you what their experiences can be very helpful. And just offering up as much knowledge as you can, and as much knowledge as people want to hear.
Thank you. That makes a lot of sense. That's helpful.
And Robin, Michael, if you guys want to hop in and answer any of these questions, I totally support that as well.
Well, I will just say that I am glad that no one has to go through the treatment that I went through, even though it cured me. It was very, very difficult. And yeah, I mean, what you said, Bianca, about the side effects of your treatment, we do hear that. And I'm guilty of it as well, talking about these new treatments that are relatively side effect free, and certainly in comparison to what existed before, they are. And many people report little to no side effects with these new therapies, but many people do, and I think that, to your point, is a part of the narrative that really gets omitted. And so I think it's important for people to understand that while many people don't experience serious side effects, some people will have some side effects.
And even just like the fear of going into treatment. Like I watched my mom go through a couple of rounds of interferon and the older treatments, and it was horrible. It was so traumatizing. And so, to walk into a doctor's office and just have them be like, oh, it's easy, it's no problem. I mean, it didn't really comfort me. It didn't, I still felt very afraid. And so that would also be one of my recommendations, is like acknowledging that fear that some people may have, especially like with our clients that we have here. You don't know what their previous experiences have been, and what kind of, PTSD they have from that. Yeah, thank you for that, Michael.
Absolutely. I would really agree with that in terms of, the knowledge or the experience they've had through someone else can be really powerful. And it's important to share with people that it's a completely different experience now. But, you know, I do tell people when I'm educating them that there's a full spectrum of possibilities. Some people even feel better when they start treatment within a very short period of time. You know, it's impossible to predict how an individual will respond. I've talked to more people I didn't feel any different than anything over these 6 or so years. But I do let them know there's a full range. Just like with any prescription drug, there's a whole page and a half of potential things. But then in general, it is well tolerated. But don't hesitate. If you have any changes, you need to talk to your treating doctor.
Yeah. And if I could just leave you all with one last thought, it's that this disease in particular can feel very isolating for people that have it. And so whether you have lived experience or you don't, I would just really stress that you just listen to the patients and do your best to not let them feel alone in this.
I mean that seriously. Thank you for closing out with that. I think that kind of honing in on this really emotional component is incredibly important. And even though most of us are not medical providers, that is something that we can all do and remind ourselves as supports for people who are going through these experiences. So I just also, to echo everyone else, want to thank you from the bottom of my heart. I think this was like incredibly moving and valuable and a profoundly important reminder. So thank you. And Bianca, I think you might have put your contact information at the front. But oh shit.
It's okay.
We will send out a PDF that we were going to send out before this all started.
Yeah, whoops.
At the end. And Bianca has graciously put her school email address, and we're saving this in the Brunch and Learn folder. I would assume that it's okay for folks to reach out to you.
Oh yeah, absolutely. Send me emails and yeah, I will. HEP is going to stay with me for a long time, so definitely feel free to reach out.
I'll stay with that.
You're part of the patient advocate network for MBHR.
Well, thanks everyone. Go do something happy and fun today, and hello, happy Monday.
Yay. And Mandy, if you wouldn't mind not closing out until the recording has saved in the chat, that'd be wonderful. No problem. Thank you, everyone.
Thank you.
Thanks, everyone.
Thanks. Bye.